Good afternoon, everybody, and welcome to another session of Bison on the Front Line. It's our opportunity to talk with former Bucknell student athletes who are helping on the front lines during this pandemic and crisis. And there are so many folks all across our country and the world that are doing that. And today I'm joined by Callista Morris, class of 2007 from Bucknell. She played field hockey for the Bison. And if you were there at that time, you probably knew her as Callista Costopoulos. Callista, thanks for taking the time out. And first of all, I just want to make a check and make sure you're doing okay and everybody's safe and healthy in your world.
Well, thank you for asking, Todd. We're doing fine here. We're, as everybody is trying to connect with family with video chats, and then we're obviously paying close attention to any of the guidelines as they unfold, and of course, practicing social distancing. But from our end, we're doing fine. I hope you guys are doing all right up in Lewisburg.
We are. We all miss the students being on campus and the interaction with them, but we know it's the safest thing to do at this point. And I should have mentioned previously, too, that you are one of the team physicians, orthopedic docs for the Bison sports program. So you get a lot of interaction with our student athletes. And I know you guys are missing that as well. And also, your job right now has to look a little differently than it normally would. So tell the folks at home who may not know who you are, who you work for, and what you typically do and what you're doing now during the pandemic.
Certainly. I'm a sports board certified orthopedic surgeon. I work for Geisinger Medical Center, and we do get to take care of Bucknell athletes, which is one of my favorite parts about the job. So I am very much missing being on campus and helping out the Bucknell students. Normally, I'm in the operating room performing elective surgeries for sports injuries. Now we've kind of shifted goals. We're on teams taking care of emergent surgeries only and doing a lot of telemedicine visits to try to keep people safe.
So can you describe for us what exactly, how does a telemedicine visit work? Does somebody pick up the phone and call you if they're experiencing symptoms and you talk them through the next steps, or how does that work?
Right now, it's scheduled like an office appointment. So if they call and they're interested in a telemedicine visit, they can be scheduled with our scheduling team into a daily schedule with any number of our providers, and it comes up in our electronic medical record as a video visit. So they will check in online, they get an email, that email provides them with a link, and then all they have to do is click the link and it will load the visit for them. It puts them in what we call a virtual waiting room. So then I can access that virtual waiting room and it brings them through to my office, and then we can talk just kind of like we are doing now. I can see them, look at their shoulder or their elbow, anything that they can provide me on the video visit to help them with their care.
Wow, technology is amazing, and it's amazing what you guys can still do when you're not right there with a patient. The fact that you're not right with the patients and you're not in the hospital per se, unless you're doing the emergency surgeries that you mentioned. Have you heard the stories, or do you know what kind of steps and processes are in place to protect you all that are working on the front line?
Yes, so Geisinger has been very diligent about working with both the CDC recommendations and then adding in their own protective measures for both patients and ourselves. We were thankful that we were able to get more protective equipment within the first few weeks. So now, if a provider like myself or if a patient enters into a hospital or the clinic, everybody gets a temperature check, myself included, and the patient, and then we're provided with a mask. So all employees, patient-facing, non-patient facing, and all patients get a mask as they enter a building. And then we also screen patients prior to their visits. So there are some patients we still see in clinic. They're for urgent matters. And prior to that urgent visit, they get screened. It helps limit the number of patients in the waiting room so that not too many patients are exposed to each other when they come in for care. So all of those things added to the telemedicine have been what we've been trying to implement to help both ourselves and patients.
And how have you, I guess for lack of a better term, the volume of cases and folks coming to the hospitals, where is that now? And I'm sure it's gotten to levels that you all have never seen before.
So the clinic volume is at the opposite level. So we have very low clinic volumes. Patients are really paying attention to the guidelines and staying at home. But the ERs are seeing a significant increase in patient care. They are actually screened outside of a tent prior to entering the ER. That way they can be placed in areas, if there's a concern for coronavirus, they are put in one section of the ER. If there's not a concern, if it's a concern for something else, such as a broken bone, heart attack, that kind of thing, they can be placed in another ER. So they're still in the same space, but it's a much different screening process. It takes a little bit longer to get through things, but it is for the better of the patient. And everybody's helping all the way down to our athletic trainers.
So the next question, I don't know if it pertains to you as much because you're not really dealing with the patient's hands-on face-to-face as much with the calls on the phone, but how are you and your colleagues dealing with this on a daily basis in terms of getting yourself up each day and coming in fresh and ready to attack this disease when you're probably seeing a lot of tragedy and a lot of sadness during this time?
Yes. So for me personally, I try to put some of the negative things going on in the country aside and focus on a goal each day. If that goal is that I'm assigned to do all of the telemedicine visits, then that's my goal for the day. If the goal is that I need to come in and work in the urgent care or operate, then that's my goal. But as long as I have a goal every day, I can then keep working to making small steps on that goal. And every small step I can make, each day's progress. And I view each day as a step closer to getting back to normal.
My final question, and again, thank you so much for taking the time out of your schedule today. So if you hearken back to your time as a student athlete at Bucknell, what might you be able to take from that experience that helps you in a situation like we're in now, and dealing with a crisis that we have?
Certainly, very good question, Todd. If athletics can teach you one thing, it's that your goals and your aspirations, they're not handed to you. You need to work very hard to achieve them. It teaches you to lose and to win and to do that with pride. If you don't like losing, you know you need to try harder, you need to train harder, and the outcome's just not going to change if you don't change. So I don't like the crisis. I don't like it any more than the next person, but I try to focus on things that are within my control. I can only work harder at making myself better during this time. And making my patients better during this time. So I try to control the things that I can, such as telemedicine, social distancing, and helping them. So I believe it was that determination that to always get better during Bucknell athletics that really has helped me today, not just during the crisis, but in all things.
Well, I can say for sure that we all appreciate you in particular, what you do for our Bison student athletes and the young men and women here in the Lewisburg area. Me personally, you've seen both of my sons and worked with both of my sons, and I appreciate all you've done there. And again, thanks for the time today. Please continue to stay safe and healthy. And I can't thank you enough for what you do for everyone on the front lines.
I appreciate that. We look forward to getting back to see you guys in person. But if there's anything I can do, any questions I can answer, please don't hesitate to reach out.
Thanks, Callista, and stay Bison strong.
I will. Thank you, Todd.